Welcome back. Now, Helen Joseph Hospital is in the spotlight following the release of a video by a patient, Tom London. In the video, London says doctors mistreat patients, detailing the conditions of taps, ceilings, boards, among other things. Now, let's unpack this further as we're joined by Professor Carol Ann Benn, who's a surgeon and breast disease specialist. Professor Benn, thank you so much for joining us this evening. Now, when you saw that video that went viral by patient Tom London, and also considering that you've served, I think it was 17 years at the Helen Joseph Hospital before you resigned back in 2022, and your resignation came with a lot of raised eyebrows for concerns around the conditions of the hospital as well. What did you make when you saw this video now?
So for me, there are some fundamental issues when we talk about patients and people. No one wants to go through any health crisis. And I think it's our duty, if we are in the health profession, to make sure that we treat people with respect, that people are performance managed on the work they're supposed to do, whether you are a cleaner, a nursing sister, an intern, a registrar or consultant, you have a responsibility to do work properly and with respectful care to patients and their needs. Yeah, it's almost 2 years to the day that I left Helen Joseph. I actually had 34 years in state service and 17 at Helen Joseph. And the frustrations were exactly that. It's really about care from all of us, and looking after people.
And it couldn't have been an easy goodbye to leave public health and a hospital that you had been with, I mean, for that one in particular, Helen Joseph, for 17 years.
Yeah, so I was very, very fortunate. My clinic, and I'm a great believer in support, as we all work as a team, but I had lots of support from foundations, and actually the unit ran as almost identical to the private sister unit. I'm fortunate that I've been able to set up something similar. But the concept, the frustrations were when you needed to bring things in, because we're at the front when you deal with patients, and to tell someone you can't do their operation or you can't offer them that service without having backings from the support team, for example, management, it makes it very difficult for clinicians, particularly when they get into trouble for trying to offer a good service. So I think it's not really about me, and unfortunately this video highlights for me what we want to really improve in our health service. And it really takes small steps in each little department to ensure that we are respectful and we offer a good, not just a medical service, but an allied service to someone who's in need.
Professor Benn, I know, you're saying it isn't just about you, and it really isn't, of course, just about you, but the public health system. But I do want to go back to your experience a little bit, just so that we can try and backtrack if we're getting worse at this. And as we're speaking, we've got visuals playing on screen now of that viral video by Tom London as well. When you resigned 2 years ago from Helen Joseph, there were also reports and people who had worked with you who had said quite often you used your own money, in fact, to buy things like surgical drains and surgical gloves. But also you had this approach that you're speaking of now, patients versus people, of putting the patients first. If you can just take us through 2 years ago and just when you reached your wit's end, what are the kinds of things that you had to work with?
So I think for me was the lack of support from management, being traumatized on management WhatsApp groups for basically offering a good service. And that's really what we need to look at. We need to ensure that there's accountability. There's accountability from middle management. I got no support either from the university or my senior management. And that for me is sad in a way. In the late 80s, the universities were prime in ensuring people's rights and access to rights. They were vocal. I think we need to go back to a way where anyone who's in any position of either power or management needs to not turn a blind eye to what is the most difficult and the most needy, and that's people who are going through healthcare concerns. I do think that we have to be able to work together with corporates and private, and I don't think anyone is not at fault here. So whether we look at private or government or anything, we've got to stop pointing fingers. And one of the people who I have most respect for, Dr. Imtiaz Suleiman, always says, look at yourself, look at what you in the healthcare are doing, and we really have to work together to improve, firstly, access to care, and that's why I came on to this show, because I think the media has a prime role in playing in pointing out what's not right, but also in a way improving it by maybe having some ways of saying to people, this is how you access your care, this is what you should expect, these are your rights, and that's important. So education and awareness, access to care. In terms of treatment, it's a responsibility to understand, even in a limited resource environment, that we can offer good care, and then to acknowledge that we need to take cognizance of waiting times. There are many ways you can decrease your waiting times. I had no waiting times in my units. Clinics should be consultant run. Theatres can run 24/7 to ensure better service. These are all small ways that we can make a difference for somebody who really needs our help and our support.
And I want us to also focus on the solutions as well. As you're saying, it's not just about, you know, raising the alarm on things that are going bad, but also just a solution for somebody watching right now thinking, look, I also had a similar experience at that public health facility. It's not everybody's experience, but it's a lot of people's experience. We must admit that. And if somebody's sitting at home saying, look, I'm operating with limited resources, I don't have money for medical aid, but I do desperately need medical care and I need good medical care, where does that person go? What's in between our public health sector basically and paid for medical aid?
So I think, remember, there are problems on both sides. That's why I'm super grateful for hospital groups like Life Healthcare and Dr. Suleiman, that I can still offer service to people who are in need in my field. But I think what we need to do for the person who's scared to access a service is go there, and when you have your service, demand your rights. You want to know that you are going to be seen, okay, that you're going to be explained what your healthcare concern is, and that you're being offered a timely timeline in the service management. So it concerns me when people wait for days and days and days, not accessing care, when no one talks to them, be it the doctors, be it the nursing care. The responsibility starts right at the very beginning. In that ward, who's responsible for cleaning? Okay. Are they held accountable to the fact something simple as cleaning a ward? Who's the sister in charge? Where is the consultant that does the ward run? What are the reporting structures, and what are the outcomes going to be when things are not done properly? So there's no reason why we can't have first-class government services. And I think it's a little bit like Gulliver, you know, the concept of trying to get the giant to stand. And I think we see that in healthcare services around the world. There's got to be small responsibilities-based units, and not nobody knows how to solve a problem. There's too much middle management and not enough consequence for action. So if you're not doing your job properly, there needs to be a consequence. We want consultants to do ward rounds, to be in clinics. We don't want things run by interns and community service doctors. It's not their job to take the load of it. It's all our load together to ensure that we have better care, because I go right back to the beginning. No one wants to go through a healthcare crisis, and you don't want to be scared or leave, for example, your breast mass or your potential cancer too long because you're too scared to access the services. I think from a public point of view, it's about understanding your rights, asking the questions, wanting to know what the answers are. I'm always surprised when people have no written, oh, I can't get my file because it's a government file, and they've got no idea what their diagnosis is, no one's explained to them. Those are important to have as a documentation, almost as a patient passport, a health passport, because next thing you go from Gauteng to Durban and you've now moved, and no one has any idea about what was the problem, what was your treatment, and neither does the patient. And so I think the public must not accept poor service, and we as healthcare professionals, be it at whatever level we are in our field, whatever our job is, must understand there's no excuse not to be polite. There's no excuse not to greet people. There's no excuse not to keep your ward and your environment in a clean state and ensure that there is service to that person.
Professor Benn, as you're speaking of, patients and people should demand their rights, demand the answers as well, pose those questions. The environment that sometimes one finds themselves in a public healthcare facility is that of being met with hostility. So if you do pose those kinds of questions, you're met with quite aggression at times. In that video, Tom London had also said that, look, we understand there's infrastructure problems. You're not going to fix the ceiling overnight, but you can fix how you speak to people. You can greet, 100%. As you're mentioning. And those are the things that aren't happening. And that also must deteriorate a patient's mental health.
Absolutely. So I think everyone should have a name badge. You should know who the person is. It's very hard to be hostile, whether it's a policeman or a doctor or a nursing sister, etc. If you've got a name tag, hi, I'm Carol Benn. Okay. This is who I am, and then it has to be dealt with. There is absolutely no excuse to be hostile when dealing with someone who is traumatized and scared and got a health problem. So you speak to them politely. They need to have the report. I think we've got to stop putting our medical fraternity on pedestals. We have to realize that you have an equal right as a patient. And I mean, doctors, we've taken a Hippocratic oath. I mean, it shouldn't be a hypocritical oath. It should be where you should be able to say to someone, this is the problem, these are your blood results. And we really have to change that. It should be, it's a common courtesy. It's like greeting someone in the street. Hello, here I am, this is my name. And it's a two-way conversation. And I think what happens is there's such a power levels in terms of what we perceive. The person with the patient is considered almost lesser, they're scared, etc. And we've got to step away from that. Your doctors are no different to what we want from our school teachers, from our police service, from anyone we deal with. And if we start asking for that, and if we don't get that, I always think something as simple little Google Forms. Everybody has phones today, in terms of like you have a little 5-point in terms of this is the person and this is what's going on. You can track percentage in terms of what people do and how they behave, and then it must be dealt with. This concept of just getting a salary and behaving badly or behaving rudely to somebody has to be addressed with. If for over an entire month, as the nurse working in a ward, you repeatedly on a 5-point checklist get naught, that has to be dealt with from a management point of view. And then maybe that person shouldn't be in the field.
Professor, is that where the disconnect is? Because I wanted to ask you, where does this disconnect happen? We're speaking about just something as common courtesy as greeting, and in that video hearing Tom London and of course others too who've complained to say that these medical professionals don't even greet, never mind give us the proper prognosis or just give us the information, the file that you were speaking of earlier, for instance. Is there a shift? Because in that video, and we obviously that will go, it's not tested or verified, but in that video, this part where he says it was young doctors and they were on their phones and they were more rude. Is it a generational thing? And of course, it's not all young doctors. Where is the disconnect?
So I think we have, I've had wonderful doctors that, youngsters that I've had the privilege and opportunity to mentor. I think you also learn things from your seniors, and it's a behavioral culture that we need to change. And the only way we're going to change that is by small performance managed steps. And again, I go back to a simple form that everybody helps fill in. This is the story, this is the ABC, and if people are carrying name badges and you know who they are, and you should be able to ask, who are you? I'm the intern in your ward today. I'm the community service doctor. I'm the registrar. I'm the consultant. You need to have people correctly named who they are, and there has to be a small, like I mentioned, Gulliver, each ward performance managed system, whether it's a ward or a clinic. It's very sad to hear people talking about my clinic now, and again, rudeness, and that was a culture that was never in the clinics. So we need to be clear, culture comes from the top, and if we run things by small clinics and small wards, be it a primary healthcare service, be it a casualty, be it dealing with the family, how you're explaining to families about what's happening with their loved ones, all those things. We throw up our hands because it's such a big problem, and it seems to be such an endemic and global problem, and we really have to take it down into bite-sized chunks. So I honestly think that there's got to be a person, and I like in my units, my nurses take responsibility for that, and they are excellent. So our nurse navigator in the unit, she's the boss of me. You know, she will check up on the doctors, check up on everything. We need to have small responsibilities in each unit to make sure that we have better patient care, because I go back to it, people are scared to come in. In fact, I write on this concept of hostile hospital environments, and people don't come in not because they don't know they've got a headache or a big growth on their nose or a lump in their breast. It's because they're scared of the response they're going to get. The access into the service is hostile, and that is something that we need to really, really improve, both locally and surprisingly internationally as well.
Absolutely. Dr. Benn, thank you so much for your time this evening and your
Absolute
contribution
pleasure.
in this profession as well.
Thank you so much.